Now we will talk with Dr. Ardern about the clinical practice and more things. Thank you so much for your time. And how can the clinicians bring to the patients the best evidence in the work, and one thing that is not so easy to do? How we can think on this?
I think it's so challenging because everyone is so busy in clinical practice, and it's really hard to keep up with all of the research that's being published. So I often encourage people to find good podcasts, good blogs, set up a journal club at the clinic or in your study group to help spread the workload of trying to keep up with all of this information. And a lot of journals now have podcasts and blogs where they summarize the research that they publish so that you don't have to then go and read every single research article that's published, and you could spend your whole life reading all of the new published work and not see any patients. So I think that's one thing, is try to find a way that works for you to keep up to date with the information. And part of that is also coming to the Sonafe Congress and going to other conferences around the world if you can, or locally, to hear what's going on, hear all of the new research. And then I think the other part of it is how you work with that information in your clinical practice. And that's going to look different for everyone, because we all work in different clinical environments. We all have access to different equipment, different spaces. So one example is, if I'm working with an athlete with an ACL injury, maybe I work in a very small clinic. We don't have so much gym equipment. We definitely don't have access to a field to do on-field testing. So that's where, if I know that I need to do on-field testing, I have to then get creative and think about, okay, who do I know who could let me access a football pitch to do that sort of testing? How could I get a good strength measure? What sort of tests? How can I work with the equipment and the space that I have to make sure that I'm doing all of the tests and doing all of the things that I'm hearing about in research and at conferences? It's challenging.
Yeah, but and I think that we need not just the technical knowledge, but the soft skills and other things. Can you talk a little bit about this?
Yeah, definitely. I really like to call them the interpersonal skills, or someone I heard recently calling them core skills, because it feels like these are skills like communicating with people, listening very carefully, having compassion and empathy when you are working with your colleagues and with patients. They're really core to what we do as clinicians, and it feels like when people call them soft skills, they're almost devaluing what we do as clinicians. So that's why I like to call them core skills. But I know that lots of people call them soft skills. So I'm totally comfortable calling them whatever. But I think as long as we can recognize that our communicating with people, how we interact, has so much impact on how that clinical relationship continues with the patient, and also how we interact with our colleagues as well, because we're often working in interdisciplinary teams or working with teams of physiotherapists. So being able to communicate in an effective way what we're doing, what we think is going on, how can we work together as a team to support the athlete or the patient, is critical. And I think it's undervalued. We don't really learn those communication skills like we learn our manual therapy skills or our exercise prescription skills. So to me, they're core. They're so central to what we do as clinicians, and they take a lot of practice.
Yes, and it's thinking in a way that the patient is the center too, right?
Yeah, for sure. And I think, again, patient-centered care, patient-centered practice is something that we hear all the time. You should work in a patient-centered way. And I always think, well, what does that mean? How do I do that? And I think some of bringing our humility and our compassion as people who care for others, that's ultimately why we've come into the physiotherapy profession. Whenever I ask people, why did you become a physiotherapist? Everyone says, it's because I wanted to help people. I wanted to help people in pain. I wanted to help athletes do do the best performance.
Mhm.
Whatever it is, we do it because we care about people, and bringing that humility and compassion and caring approach is, in my mind, a really important part of delivering effective patient-centered care.
Mhm.
And the other part of it then, of course, is the multidisciplinary or interdisciplinary collaboration. It's about bringing in the patient's family or the teammates or the people who are in the context around the athlete or the patient, and really supporting the athlete or the patient to make the decisions that's best for them.
Yeah. Oh, thank you so much.
Pleasure. Thanks for the opportunity.
Oh, you're welcome.